Yeah, Dr. Narendranath here from Ramaiah Medical College Hospital. I am the Chief Administrator looking after the entire operations of this Medical College Hospital. If you look at healthcare, mostly healthcare, if you look uh, last century, it was more manpower dependent. Even today people say there is so much of doctor deficiency in us. But what I think future is the technology. And if you want to look at quality and also create evidence based medicine, and what we will look at is the technology which is coming up. I think healthcare technology, they are saying, is going to be one of the most very similar to industrial revolution. Next 10 years, next decade is going to be healthcare is a lot more dependent on the technology. I think that is going to be the trendsetter. Same thing will happen also in education. What we practice today is learned by the doctors, the future doctors, and that will going to continue. Correct. Most important is to make them IT literate, in the sense of not like a lot of our students are already use a smartphone, but we want to tell them how to use the smartphone in the right way. We have started implementing last 2 years on the electronic medical record. So what is electronic, and we also look at the way clinical documentation check. There is a form international way of documenting. If you look at traditionally, they are all paper based, and they are tuned up to writing on a paper and not on the IT. So today we are teaching and training all our students how to do documentation on a digital format, and that is what one of the things we are looking at. And second is, we also try to teach them also the kind of gadgets we are going to. We have bought the best technology in our setup, not only as per our Medical Council of India's requirement, but beyond that, as per the industry standards, we are able to buy the technology and expose them what technology is useful for it. For example, anesthesia, we do not use the traditional methods of anesthesia. Today we use all the modern sevoflurane, and we have done away with halothane. So we are telling them how the newer methodology or newer technology, newer techniques comes into force, and they should get exposed. But at the same time, we also should prepare them how they get used, means capable of handling cases at a B center or a C center. So that is what we are trying to do. One of the most important challenges we faced is there is a mix of medical professionals. There are senior doctors who come with a lot of wisdom and intellect, but they are not IT savvy. Look at, but we have youngsters coming IT savvy, but their knowledge gap is too much. So the bridging this knowledge gap and IT skill development is a big challenge when we are implementing the newer modern technology in the IT. If you look at all the new guys coming up, they always want to use the new technology. The seniors thinks the most traditional way is still the better in any of the specialty, even cardiology and cardiac surgery or anywhere. Most senior doctors still use stethoscope. If you ask a junior doctor, he will say, I want echocardiography, right. So meeting the requirements of seniors, meeting the requirement of the junior staff is a big challenge for an hospital like this, because a junior would always equip himself with the knowledge and come back, but seniors are not very comfortable with the technology, and that is a big challenge. As I already said, one of the thing is we equip ourselves with the modern technology so that the students and the faculty is going to expose that to the technology. Second, we lay a lot of emphasis on research. We encourage people to do a lot of research, doing research and compete in the research area to get a lot of funding for research, so that we get ICMR and other fundings, so that we also can acquire the technology, and people also can get, we create an ecosystem or environment to do that research component. So this is a major area, because they are come with a lot of knowledge, they already can have, and we have already created a large patient base. But today what we are trying to bring the continuum of care and the technology which is relevant to that, so that we create ecosystem, they also can do concentrate on research, and this is a major differentiator compared to. Okay, being NABH assessor, I am also the member of the CAHO. CAHO is the Consorted Accredited Healthcare Organization. We call the NABH. What we are looking at is how do you take quality beyond accreditation. Accreditation has a certain criteria to fulfill and they reach that level. But is that enough or should we go beyond accreditation? So, what we are trying to get is adapt a newer tools and techniques of quality monitoring and measurement, and how this can be implemented in the member organizations. So, every year what we do is every year the number of people participating in this is increasing. If you say first year there were about 400 delegates, second year there were about 500, 600. This year we are targeting about 800 to 1000. So, with that what happens is the member organizations will be able to implement the best practices in the industry, right, or throughout the country. For example, if you look at critical care monitoring, okay, each hospital has a different way of doing. But if you look at some of the leading hospitals in the industry, they have a different metrics of measuring, identifying patient, who has to get admitted in the ICU, when is the right time to get them discharged, and is it documenting all these evidences. So, we are also trying to can we get a same platform of measuring the hospital from the quality perspective. So, we are also trying to implement IT solutions where all hospitals can follow similar formats. Our hospital is keen on international collaborations. We have tied up with many universities, both Europe and US. In Europe, we have tied up with Ghent University and many other universities in the Europe. But mainly we are focusing with our collaboration with the University of Illinois Chicago. We are doing in the area of global health. We are collaborating in the area of on cancer treatment. We are in the area of bone marrow transplant. We are also doing in the area of pediatric and mother and child health. What we are trying to bring in is there are certain areas which still unexplored, or Indian system has not been capable. We are not having the professionals having that capability to handle those cases. So, because we have identified UIC as one of the most leader in US in the medical fraternity. So, what we are trying to do is faculty exchange program. So, we will wanted to some of the faculty to send there for training for a brief period of 3 to 6 months, and those specialties we can develop here. We also are focusing on student exchange program, where some of our students goes as a summer vacation, summer program, get exposure for 3 months or 6 months. We also have lot of students from UIC coming to Ramaiah for exposure to community health, critical care, because and also other kind of skill development, because their number of patients available are quite less compared to Indian situation. So, we have mutual benefits, and last 2 years we are working, and we are also working in an area called Heart Rescue International, which is by supported by Medtronics International. What we are trying to is today within the traffic Indian traffic situations and Bangalore traffic situation, a cardiac patients reaching to the main center which facilities are available is taking a lot of time. So, we are trying to work how do you provide the most effective pre-hospital care, or kind of situation where a patient at the time of event occurs, even the remote part of the Bangalore city, it should be within the reasonable time, or maybe 5 minutes or 10 minutes, you should be able to get that access to the effective treatment. So, we are working with UIC and Medtronics International, and there is one center, only 3 centers in the world is happening this: Chicago, Bangalore and China. So, we are part of it, and we are creating a system for Heart Rescue International. So, one of them is like for example, your liver transplants or bone marrow transplants, or kind of heart transplants. So, these are the areas where people have not really developed expertise. There are very few centers who are operating on this. So, why not a center like us, who is a tertiary care medical college hospital, should also develop this capability. So, we are collaborating in those areas with the UIC and get that kind of knowledge transfer or skill transfer from them, so that we create a center of excellence. That is what.